Hello guys, so how are you? How are you all? Dr. Benedict, I'm fine, thank you so much. Osama Sheikh, good evening. Rishiraj, namaste. Hi Nandini, Ritika Tapa, hi. Thank you. Thank you, Benedict. Shah Manish, namaste. Delay. Gopiraj, hi. Isiako Ibrahim, hello. Isiako Ibrahim, good evening from Russia. Good evening. Dobroy Vicher, maybe. Yeah. Vasu, regarding the anatomy of the lower limb, we have already discussed it. There are already two parts on lower limb. It is a 4-hour session. We have already discussed it. Hi Charles, how are you? Sanaula, hello. Prashil, good evening Prashil. Mugundan Balaji, good evening. Mordecai, good afternoon from Africa. Good afternoon. Hi Medbooster, hello. Charles from Kenya. I have a lot of friends from Kenya as well. Isiago Ibrahim, Kakdila, Harasho, Kakwas. Yes, head and neck also will discuss. Once we are done with the upper limb, we shall also discuss the head and neck anatomy also. We shall discuss completely. But I just wanted to keep this thing that in the previous class, we have discussed all these things, right? I hope all of you remember in the previous class what all we have discussed, right? So we have discussed about all. Good night, TRG. Good night. But my night is not yet. Niza Chanda, hello. Mukai, good evening, Mukai. Gopal Krishnan, good evening. So, guys, delay. So, guys, previously we have discussed Khan by neuroanatomy. Neuroanatomy, I will start neuroanatomy very fastly, right? Don't worry. Aisha, hello, Aisha. Yes, Vasu, leg and foot nerves, arteries, okay, all the muscles, all the clinical points, even the clinical points also, along with the MCQs, everything we have discussed in the previous session, okay. Wherever I discussed the lower limb, so there we have completed completely. So I want you to just go through that, okay. Med Booster, thank you so much. I'm fine, Mohammed. I'm fine. How are you, Mohammed? Ammu, good evening. Right, guys. So we have discussed regarding the arm, the scapular region. We have also discussed the arm region. We have discussed the anterior compartment. We have discussed the posterior compartment. We even have discussed the forearm. In the forearm also we have discussed the anterior compartment, the posterior compartment of the forearm, right? So we have discussed all these things. So now today we shall be continuing a little part because we haven't discussed the arteries, right? So we shall discuss the arteries also, and not only that, we shall also do a lot of questions. And in the abdomen especially, guys, I'm going to teach you very interesting things which are really very difficult, and really it is very difficult for you as well. So we shall be discussing everything today along with these MCQs, okay? Right, so let us get started, guys. So TRG Abhi YT, I'm not. What do you think? Am I married or not? You am I, do I look like I'm married? Right. So, Vasu, I want you to attend this session on the upper limb so that even if you have any doubts, you can ask here. Okay. So, look here now. Yes, all of you look here. Everyone. Cyanide, Privyat. Right. So, look here now. Yesterday, we have discussed two muscles, isn't it? In the superficial group, the last muscle which we have discussed was flexor digitorum superficialis. And I have already told you that there is a muscle starting from the flexor compartment and it goes all the way like this and inserts to your thumb. So what is that muscle which goes all the way and inserts to your thumb, guys? What is that which inserts to your thumb? Yeah. What is that muscle which inserts to your thumb? Anyone? Any answer? Excellent, Osama Sheikh. It is flexor pollicis longus, right? It is flexor pollicis longus. Very good, Osama. Very good. Ayman Kazi, yesterday you were there in the class, right? Excellent. Komal, excellent. Right? So flexor pollicis longus. Now, all of you guys, all of you, stop commenting now. All of you, Muhammad Zakar, excellent. All of you guys, I just want to teach you one very important thing. Now, what is that very important thing is that just concentrate here. Let us say that these are your beautiful fingers, which I'm trying to draw them. Right. So this is your hand, for example. For example, this is your hand. Okay. I know it is not clear, but you know, please bear with me. This is your hand. Now, I told you that yesterday we have got flexor digitorum superficialis, right? So it starts here and all the way it comes here and it divides into four tendons and these four tendons get attached to your four fingers. So what I'm trying to draw now is that these are those four tendons. So these are the four tendons. So this is one, okay, and this is a very clinical point I'm telling you now. All of you pay attention. This is two, this is the third tendon, okay, and finally we have got our fourth tendon. So this is our fourth tendon. Okay, so these are the four tendons which we have. And also I have already told you that we have got a muscle here, flexor pollicis longus, right? So this is your flexor pollicis longus. This is your flexor pollicis longus. Okay, so what is this? This is your flexor pollicis longus and this is your flexor digitorum superficialis. Yes, Aisha, I'll be teaching abdomen today. Okay, we are just left over with few topics of upper limb. After that I'll teach abdomen. Okay, so all of you concentrate here now. This is flexor pollicis longus. Now all of you look here. Enthusiastic, yes, I'm teaching also for 2022 FMG. Okay, we even will have the rapid sessions. Even this entire thing which I'm teaching will be important for that session. Okay, many MCQs will be covered that. Okay, if you watch my previous lives, you will understand it. Right, so I want you to continue here, all of you. Now, these tendons are so important, guys, because very easily you can get an infection of a tendon. So for that reason, tendons are covered by a special sheath. You know, any charging wire you take. Now the wire is so important, right? You can't damage that wire. So for that, there is a plastic wire or a plastic coating surrounding the wire, your charging wires or whatever it is. So in the same way, even each tendon is covered by a sheath. That sheath is called a synovial sheath. So let me draw it and explain you. Look here. This is the synovial sheath that is covering the tendon like this. This is the synovial sheath that is covering the tendon like this. Okay. Next, all of you concentrate here. Don't Yes, don't comment anything now. Don't comment. Thank you, enthusiastic. Thank you, Aisha. Don't comment. Just concentrate here, guys. I'm telling you, believe me, I'll teach you very nicely all the things. You need not to worry. Okay? Just concentrate here. What I'm trying to teach you is that the little finger has got a tendon that is called flexor digitorum superficialis. Surrounding that, protecting that, there is a sheath called a synovial sheath. So this red color thing which I've drawn is a synovial sheath. But if you look at the tendons, or if you look at the synovial sheath of the first finger, second and the third, these three fingers, look here. This is how the synovial sheath is. This is how the synovial sheath is. Now, what comment can you give about these synovial sheaths, guys? What is the comment is that the synovial sheath of little finger is continuous all the way down till here. But the synovial sheath of the middle finger, the index finger, the ring finger, the synovial sheath is only limited till this part, isn't it? It is discontinuous. But when you look at flexor pollicis longus, even the synovial sheath of flexor pollicis longus is also large. It is continuous all the way down. It is Rajeshwari, good evening. Mulenga, no, abdomen I'll teach you now. After that, I'll put these notes, okay? So look here. Overall, what I'm telling you is that here the synovial sheath is continuous all the way. Thumb finger also, the synovial sheath is continuous all the way. But these three fingers in between, the synovial sheath is only limited. So what I am trying to explain you. So this is your synovial sheath. Let me write it down. This is your synovial sheath. Synovial sheath. Okay. Now within this synovial sheath, can you please tell me what is this space? This yellow color space, whatever you are drawing here, what is this yellow color space in between these synovial sheaths? This yellow color space is nothing but called as bursa. Bursa is nothing but an open cavity. This is bursa. Now, this yellow color bursa is present on the little finger side. It means ulnar side. So can I call this bursa as ulnar bursa? Can I call it as ulnar bursa? Right? This is called as ulnar bursa. Then, now you will tell me the bursa which is present here near this flexor pollicis longus. What kind of bursa is this? Can anyone answer what kind of bursa is this? Okay. Let me change the color. You know, this pink color thing. What kind of bursa is this? What is this kind of bursa here? Anyone? Yes. Very good, Dr. Benedict. Excellent, excellent. Ayman, Med Booster, perfect. This kind of bursa here is called as radial bursa. Radial bursa. Now, all of you, Srikanth, right? Osama Sheikh, right? Yes. Minu Sri, right? Rex Gaming, everyone is right. Everyone is right. I'm really happy, guys. You are really attentive. Excellent. So look here. So these bursa. Now what I am trying to tell you, a clinical point here is that, guys, all of you know that, for example, all of you look here. For example, if there is any kind of infection, which has been developed here, let us say there is some kind of infection that has been developed here. Let me use another color. Okay, black. So if there is any kind of infection in the little finger, okay, let us say I fell down and there was some little bit trauma to my little finger. So infection will enter into the little finger. Now this infection will pass down all the way. This infection will pass down all the way down here, and this infection is going to infect all my tendons of flexor digitorum superficialis. So what patient will complain is that, doctor, 2 days back I fell down and there was a bleeding to my little finger, but today I have pain in the wrist. Now as a doctor you should explain that it is a continuous channel. The ulnar bursa is completely infected, and that is the reason why all your tendons have been inflamed. In the same way, another patient comes to me and tells me, doctor, I fell down and my thumb finger got infected. There is a lot of bleeding from my thumb finger. Now, after 2 days, I'm coming to you complaining that I have a lot of pain along my thumb finger downward. I have a lot of pain all the way till here. I feel like there is some infection here. So, ulnar bursa is completely infected, radial bursa is completely infected. But if I have any kind of infection in the ring finger, do you think will it pass down? No, because the sheath is only till here. So, infection will be only limited. Even for the middle finger also, and even the same for the ring index finger also. That is the reason why. That is the reason why whenever they are taking any kind of blood test, right? Whenever they're doing any kind of RH typing, blood grouping or whatever it is. So they basically take blood from your fingers, isn't it? So they can use these 3 fingers. That is the reason why the nursing staff, the medical staff, they use these 3 fingers. They don't take blood from the thumb nor the little finger. Why? Because if there is a chance of infection through the needle, the infection can pass down and infect your entire wrist. Is it clear? And this infection of the synovial sheath is called as tenosynovitis. Okay, so infection of the synovial sheath is called as tenosynovitis. Tenosynovitis. Is everyone clear, guys? Right. Excellent, 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 and excellent. So this is one clinical point, guys. This is one clinical point which you need to know. Mia Khalifa, I love you too. Thank you. Right. So in any kind of infection, if you see, yes, Komal Aswani, radial bursa. Yeah. Now look here. Now look here, guys. Look here. Another important clinical point I want to tell you is that all of you should concentrate here now. Another clinical point I want to tell you is that, you know, whenever you are washing the clothes, I mean, which you usually don't do, but whenever you're washing the clothes, obviously you use your fingers to wash the clothes, but when you're washing it, mostly this region is in contact. Mostly this region is in contact. Or let us say a mother is lifting her baby. Okay, she lifts her baby, right, and she closely adheres the baby to her breast and she milk feeds the baby. So as she's feeding the baby, she'll catch the baby like this. So as she's catching the baby like this, a lot of pressure is impended like this. You don't catch the baby in this way, right? You catch the baby like this. A lot of pressure is impended on this part of the wrist, on this part of the finger over here, right? So what will happen is that due to constant tension, due to constant pressure on this area, the radial bursa will be inflamed, right? The radial bursa will be inflamed. And when the radial bursa will be inflamed, you call, and you know what will happen when the radial bursa will be inflamed? This entire region will be swollen off. There will be swelling of this entire region, right? Actually, what is swelling? It is not the finger which is swelling. It is the synovial sheath which is swelling, right? So what will happen is that there will be swelling of synovial sheath. So whenever there will be swelling of synovial sheath, this condition you call it as mommy thumb. This condition you call it as mommy thumb. Okay. So the other name, what do you call it as? Washer woman thumb or washer woman thumb. Okay. And yes, bursitis, Dr. Benedict, it is called bursitis. Inflammation of bursa is called bursitis. Or the other name which you give for this is decurvain tenosynovitis. What did I say? It is decurvain tenosynovitis. Tenosynovitis. Okay, so this is the important clinical point. Sir, what is the type of question which they can ask me? They will simply ask you that which tendon is inflamed in case of mommy's thumb, or inflamed in case of washerwoman thumb, or inflamed in case of decurvain tenosynovitis. Which tendon, guys? Obviously it will be, yes, your answers are needed now. Which tendon will be inflamed? Sannyasi, it is used for both of them. Tenosynovitis means inflammation of the tendons, right? So overall, it can be anywhere. Tenosynovitis can be anywhere wherever there are tendons which are inflamed. That is called tenosynovitis. Very good, Ashish Yadav, Med Booster, Osama Sheikh, excellent. Excellent, it is flexor pollicis longus. Ministry, excellent. Flexor pollicis longus. Very good, guys, excellent. Now we shall be discussing, yeah, all of you concentrate here. I just want to give three important points. And then we shall enter into the main topic. Okay, I just want to give three important points. Look here. Yesterday I taught you about axillary nerve. I have already taught you about musculocutaneous nerve. Muhammad Zakar, it is flexor pollicis longus, you are right. Vasu case, yes, radial bursa, you are also right. Next, radial nerve. I have taught you about these three things. And what did I tell you guys? I have also taught you that the root value of axillary nerve, I told you to remember that it is C5, C6. Okay, C5, C6. And I hope all of you know the alphabets, I mean the numericals, right? After 5 and 6, what will come? 7. So C5, C6, C7 is your musculocutaneous nerve. After that, what will come? 8. So C5, C6, C7, C8 and T1. All this is the root value of your radial nerve. All this is the root value of your radial nerve. Now, I told you yesterday that axillary nerve supplies two muscles. Okay, I told you to remember a mnemonic DAT, DAT. DAT, DAT. What is DAT? Good evening, Johnny Sens. Good evening. Oh my God. I think the world famous people are over here, right? I'm really lucky to have them. So, anyways, jokes apart, I told you that axillary nerve supplies two muscles. What is that? D for deltoid, T for teres minor, right? I've discussed this yesterday only. I have even drawn the muscles also, right? Deltoid as well as teres minor. Excellent, excellent, Med Booster, excellent, Ayman Kazi, excellent. I also told that musculocutaneous nerve supplies your forearm, not forearm, arm. In the arm region, musculocutaneous nerve supplies your anterior compartment, but whereas posterior compartment is completely supplied by radial nerve, right? So in the anterior compartment, all these muscles are called as flexors. So all these flexor muscles of the arm are supplied by your musculocutaneous nerve. So can I write anterior compartment of arm? And radial nerve supplies where? Radial nerve supplies the entire posterior side. In other words, I can also tell that the radial nerve supplies your entire extensor compartment, right? So extensor compartment, extensors. So guys, why am I telling you this again? Because I wanted you to remind, right? I want you to remember all these things because many questions will be asked, guys. Many questions will be asked. Very, very, very important box, right? So if you have understood till here, now I will jump into the arteries. There is no need to tell because you already know how important the arteries of the upper limb are, right? So tell me, did you understand? Karma Gaming says anatomy lectures are recorded, right? And they will be uploaded soon in the app. No, Sannyasi, posterior compartment. Yes, I mean it is continuous like this, right? Brachioradial is from the brachium to the radius. On the posterior side, it is continuing like this. So that is the reason why I have told you in the arm as well as in the forearm also. Okay. Yes, Prashanti. Thank you, Mia Khalifa. Thank you so much. App, it will be, everything will be told within this Telegram group, guys. Right. So did you Did you understand everything? Right? Have you understood everything? So that I'll go into the arteries now. I just want a green signal from everyone. You comment, and in the meanwhile, I'll write the heading. All of you should be fast, guys. We even have to teach abdomen today. I hope you remember it. Okay, fine. Right? Right. So look here now. I'm just going to give you, yes, Ashwad, I'll be teaching you everything. Don't worry. I'm going to give you an overall perspective of this. Look here, guys, all of you. First of all, let me draw the arteries of the upper limb. Okay, arteries of the upper limb, and then I'll go and teach you the detailed arteries of upper limb. Okay, so look here now. So this is your heart. Okay, now all of you know, coming out of your left ventricle, you have got this artery that is coming out of the left ventricle. What is this? This artery is called as aorta. What is this artery, guys? This artery is called as aorta. Okay, so this is called as an arch of aorta, and which is descending down is called as a descending aorta. You know it. Now look here very carefully. All of you look here very carefully. So here we have got a trunk like this. This trunk is called as brachiocephalic trunk, BCT. Okay, so this is called as Mukai Gopal Krishnan. It is deltoid muscle. I have told you yesterday. I want all of you to concentrate right now here. Okay, so this is called as brachiocephalic trunk. Okay, what is this called? Brachiocephalic trunk. Now, brachiocephalic trunk will divide into two branches. What are those two branches? Which is going on the right side. This is called as right subclavian artery. Right subclavian artery. This is called right subclavian artery. And which is going up is called as common carotid artery. But it is on the right side, right? So I call it as right common carotid artery. Now coming on to the left side, coming on to all of you stop commenting. All of you stop commenting. Now just look at what I'm teaching. Okay. Coming on to the left side also, we have got two branches. What are these two branches? This is called as left subclavian artery. We have got right and we have got left subclavian artery. And next we have got common carotid artery. But what common carotid artery? This is your left common carotid artery. Left common carotid artery. Okay. Now, these common carotid arteries, they in turn divide into two branches. One is called as external carotid artery, which is going away, and which is going up and inside. This is called internal carotid artery. This is called internal carotid artery, and this is called as external carotid artery. The same on the other side also. The same picture on the other side. Okay. The same picture on the other side. Now look here. These are the branches here. Okay. Now, what is the important thing you need to know? The important thing is we are first mainly focusing on the axillary artery, right? And the subclavian artery. Okay. So look here. This subclavian artery comes down all the way like this. This subclavian artery comes down all the way like this down here. Now, from this entry point till here, this is called as subclavian artery. Now from here till the next point, this is called as an axillary artery. Axillary artery. Okay. Now axillary artery will continue down as brachial artery. Axillary artery will continue down as the brachial artery. And brachial artery will in turn divide into two branches. What are these two branches? Which is going on to the axillary artery will come down all the way. From there, the brachial artery will come, and this brachial artery will divide into two branches, right? One going on the right side is called as radial artery. One going on the left side is called as ulnar artery. So this is called as a radial artery, and this is called as the ulnar artery. So radial artery and ulnar artery. Clear? So if you want a much more clear understanding, so look here, guys. Let us say, I'm just drawing it roughly. This is your forearm like this. This is your forearm in this way, right? So this is how the arterial anastomosis are, right? So I'm minimizing the picture. I hope you understood now. Is that clear to everyone? This is just the basic part. This is just the basic part. I just wanted you to know that we have got subclavian artery, which continues as axillary artery, which continues as brachial artery, and finally it divides into radial and ulnar artery. Till here, is everyone clear? Yeah? Right. Good. Very good. Excellent. Fine. Fine. Right. Now look here, guys. First, we shall discuss. First, we shall discuss the branches of axillary artery, and then we shall discuss the branches of the subclavian artery. Okay. So first, we are mainly concentrating on this part. That is the branches of axillary artery. Okay. First, we shall be concentrating the branch of. Okay, Sakib. Yes. Now, all of you put your pens down. Just listen to what I'm telling. Later on, you can make the notes. I'll tell you. I'll give you time for you to make the notes. Look here. This is your sternum. This is your sternum. All the way like this. Okay. And after that, you have got your clavicle like this. So all of you know that this is your clavicle. This is your clavicle. And from here, you have got your first rib. What is this rib? This rib is called as your first rib. This is your first rib. And after that, you have got your scapula in this way. You have got your scapula here. And obviously, this is your humerus. I'm drawing it fastly. Okay, this is your humerus like this. Now, look very carefully. What I'm trying to tell you is that here we have got a process called as coracoid process. All of you know this is called as coracoid process. This is called as coracoid process. And even here we have got two lips. One is called as the medial lip, another one is called as the lateral lip. Okay, so let us say that this is called as the lateral lip. This is called as the lateral lip. Now, there is a muscle that is coming out like this, out of this coracoid process. So this muscle is originating from the coracoid process. And yes, what is the name of this muscle, guys? The name of this muscle is pectoralis minor. Pectoralis minor. Okay. Next, there is another group of muscle that is coming from the lateral lip. Now you will tell me what is the muscle that is originating from the lateral lip, guys? Very important. I don't want you to confuse. What is the muscle that is coming out from the lateral lip? Yes. Anyone with any of your answer? Not pectoralis. Very good, very good. Pectoralis major. Sannyasi, it is not just major. You have to tell me what it is. Pectoralis major or teres major. Okay, it is pectoralis major. Okay, it is pectoralis major. Now, look here. I just made a little mistake here. What is that little mistake? Is that I'll tell you in a minute. I actually have to discuss about not lateral lip, rather I am discussing about medial lip. So now you tell me which muscle comes out of medial lip? Which muscle comes out of the medial lip? This is the medial lip. Very good. It is teres major muscle. teres major muscle. Okay, Ayman, Kazi, very good. So right guys, so this is the basic thing. This is the basic thing which you need to know. Now, what I'm trying to teach you here is that, what I'll be teaching you is that I'll put this same structures again, but I'll remove the unnecessary structures. Now, I'll remove the unnecessary structures and I'll put the same structures. Now look here, I'm putting the first rib. This is your first rib like this. Okay, very good all of you. Saqib, Rafi, very good. HS vlogs, excellent. Okay, right, look here. Now here I have got coracoid process, I already told you. Now from the coracoid process, a muscle that is coming out, and this muscle is called, you already told me, this muscle is called as pectoralis minor muscle. Okay, so this is called as pectoralis minor. After that also, from the humerus bone, exactly from the medial lip, we have got another muscle that is called as teres major. That is called as teres major. So, what are the branches of axillary artery? What am I trying to teach you till now? What am I trying to teach you till now is that axillary artery has got many branches. But first of all, you should know that this branch which is coming down like this is called as subclavian artery. Okay, what is this? Subclavian artery. And subclavian artery is coming till, it is coming till the lower border of the first rib. So look here, subclavian artery is coming like this all the way. It is coming like this all the way. It is coming till the lower border of the first rib. Okay, from the lower border of first rib, it is not called as subclavian artery. From the lower border of first rib, it should be called as axillary artery. Okay, so from when? From the lower border of first rib, from the lower border of first rib, you call it as axillary artery. So till here it is subclavian artery. Now from now you call it as axillary artery. Okay, now this axillary artery comes down all the way, and this axillary artery passes behind pectoralis minor muscle. It passes behind the pectoralis minor muscle, again comes down all the way, and now it passes above teres major muscle. It passes above the teres major muscle. So this entire course of this artery is called as axillary artery. Now axillary artery has been divided into three parts. Now what are those three parts? So this is the first part. First part is above pectoralis minor muscle and below the first rib, below the lower border of the first rib. Okay. Next, second part is behind the pectoralis minor muscle, and third part is after the pectoralis minor muscle. So this anatomical landmarks are very, very important, guys. Very, very important. Okay. So you should know definitely what are the parts of axillary artery. Okay, one is below the lower border of first rib, above the pectoralis minor, that is the first part. Second part is behind it, third part is after it. Is everyone clear so far? Everyone, come on. Very good. Excellent. Very good, HS vlogs. Right. So if you look at the arteries, guys, the first part gives out only one artery. Okay, the first part gives out only one artery. Papa, hello. The first part gives out only one artery. Second part gives out two arteries. Third part gives out three arteries. First one, second two, third three. Okay, so now we shall discuss what are those arteries. But before discussing those arteries, you have to remember, before discussing the branches, you just have to remember a small mnemonic, guys. A small mnemonic you have to remember here. Now, what is this mnemonic? Remember it as 16's love songs and poems. 16th law, songs and poems, right? So I kept this mnemonic. If you want any other mnemonic, you can keep it. So the first part is having only one branch, that is 6. Second part is having 2. Third part is having 3 branches. Now what are the names of these branches? Look here now. S stands for superior thoracic artery. What is this? Superior thoracic artery. Okay. And what does T stands for? T stands for thoracoacromial artery. Thoracoacromial artery. And what does L stand for? Any idea? Yes? Divesh Mishra. Good evening, Divesh. Right? Any idea? Asif, Ayman, HS Vlogs, Sanyasi Pandit. Any idea of what does L stand for? L stands for lateral thoracic artery. Okay. And S stands for subscapular artery. Subscapular artery. And what does A and P stand for? Yes, what does A and P stand for? Look here, guys. Very simple. Abhiram Rao, excellent. Lateral thoracic artery, excellent. Dr. Benedict, excellent. Osama Sheikh, excellent. Very good, guys. You really are pro. You're all pro. Very good, Muhammad Zakar. Very good. So, look here, guys. Let us say this is my humerus bone. Okay, I don't have a humerus bone here. Right. So, let me take up this humerus bone, guys. So, this is the humerus bone. Now, in this excellent Karma Gaming, you are already answering this. Excellent, Sanyasi Pandit. This is the humerus bone, right? From the anterior side, this is anterior side. Okay. So, wherever there is greater tubercle, that will be your anterior side. So, from the anterior side, there is an artery that is making a circle. From the posterior side also, there is an artery that is making a circle. So, this is called anterior making a circle. So, circumflex, humeral artery. P stands for posterior circumflex humeral artery. So these are the branches, guys. Sir, should I really remember all these pictures? You need not remember any picture. What are the important things you need to remember is that you have to remember the course of this axillary artery, from where it started, how it is passing above and below the muscle, how many parts, and next thing you have to know is the branches. So these are enough. Okay, did everyone understood this? Tutko Habila, excellent. John Faizan, excellent. Very good. And one very important clinical point I want to tell you is that, guys, out of all these arteries, this lateral thoracic artery, this lateral thoracic artery it mainly supplies your breast. I mean, the female breast. Okay, it supplies the breast. So that is the reason why lateral thoracic artery is very well developed in females in comparison with the males. Okay, so that is a clinical point you need to remember, that lateral thoracic artery is very well developed in the female population because it mainly supplies your breast. Okay, right. Now, another very important thing, what is that, is that we have discussed axillary artery, and after that I promised that I would discuss which artery, that is the subclavian artery. Now, all of you should pay attention while I'm discussing the subclavian artery, because mnemonics are really important, but mnemonics are not all the time important, because mnemonics will always confuse you. So guys, please don't write anything, just watch to what I'm teaching you. Okay, look here. Right now I'm discussing subclavian artery. This is your C6 vertebra. This is your C6 thoracic vertebra. Okay. Now, just beneath this, you have got your sternum, right? So, this first part is your manubrium like this. And all the way down, you have got your sternum like this. All the way down, you have got your sternum. Okay. Next, another important thing is that you have got a rib like this. Now, this rib which I'm drawing here, this is called as your first rib. This is called as what? First rib. And this is called as your second rib. First rib and second rib. Clear? Now look at the arteries. Look at the arteries. Subclavian artery is also divided into three parts. Now how is this? How is this is that all of you look, there is a muscle. Okay, I'm drawing the muscle with the green color. All of you look, there is a muscle called as anterior scalene muscle. Okay, we have got three scalene muscles attached from the neck all the way to the first rib and the clavicle. These are called as anterior scalene muscle, middle scalene muscle, and the posterior scalene muscle. So right now I'm drawing anterior scalene muscle. Okay, so this anterior scalene muscle comes down all the way and it attaches to your first rib like this. So this is your anterior scalene muscle. What is this? Anterior scalene muscle. Okay, anterior scalene muscle. Now look here, this artery which I'm drawing like this is called as subclavian artery, right? So this was your brachiocephalic trunk, and the artery that is coming like this is called as your subclavian artery. So this subclavian artery, it passes behind the scalene muscles. This subclavian artery passes behind the scalene muscles and above your first rib. So this is how the subclavian artery is passing. It is passing behind the scalene muscles and above your first rib like this. Okay. All of you look. So in this way, subclavian artery is divided into three parts again. What are those three parts? Before the anterior scalene muscle, this is called as the first part. Behind the anterior scalene muscle, that is called as the second part. After anterior scalene muscle, this is called as the third part. So how many parts of subclavian artery I have? I have got three parts. Three parts of subclavian artery. Now what are these branches? What are these branches are? First of all, let us discuss the first part. The first part. Now the first part is having many branches, guys. It is having many branches. Look here very carefully now. One branch goes above, it ascends above like this, it passes through these opening and goes out. Okay, we have got a vertebra. Vertebra has got spinous process. Spinous process has got foramina. These are called as transverse foramina or vertebral foramina. This artery is passing up like this through these vertebral foramina. Okay, so that is the reason why this artery is called vertebral artery. So what is this artery should be called as? This artery is called as vertebral artery. So the first part is having an artery called as vertebral artery. Second artery. What is the second artery? Second artery is that exactly the second artery comes down like this. You see, the second artery is coming down all the way down here. Now, if this is my subclavian artery, all of you concentrate. If this is my subclavian artery, the second artery is descending down into the thoracic cavity, isn't it? It is descending down into the thoracic cavity, right? So if this artery is descending down into the thoracic cavity, then can I call it as internal thoracic artery? Yeah. So the second artery will be called as internal thoracic artery. What is the second artery called as? Internal thoracic artery. Clear, everyone? Now what is the third artery? Third artery is that, look here, this is the third artery. The name of this third artery is thyrocervical trunk. Thyrocervical trunk. Excellent. This is called as thyrocervical trunk. What do I mean by thyrocervical trunk? It means it supplies two things: thyroid region, cervical region. That is why it is called thyrocervical trunk. So where is the thyroid region? Let us say here I have C6, here I have C7, right? Somewhere here I have got my thyroid gland, right? So it gives a branch that goes like this towards the thyroid region. So this is called as thyroid artery, that is the inferior thyroid artery. And there is another branch that goes transversely like this in the thoracic region. This is called as transverse cervical artery. Okay, transverse cervical artery. So this is your thyroid gland like this. Okay, an artery has come, and this is your neck like this, and an artery has come like this. This artery is supplying from the inferior surface of the thyroid gland, so I call it as inferior thyroid artery. And there is another branch of it which is passing transversely in the cervical region on both the sides. This is called transverse cervical artery. Am I clear, guys? Yeah, this is called as transverse cervical artery. Am I clear? Answer fast, because we even have to start the abdomen part. Okay, answer fast now. Am I clear? So what I was telling you is that this is the first part, second and the third branch is thyrocervical trunk. Thyrocervical trunk. Thyrocervical trunk has got two branches. One is called as transverse cervical artery. Another one is called as inferior thyroid artery. Inferior thyroid artery. Right. So I hope it is clear for all of you. Right. Fine. Fine, guys. So I want your answers, guys, whether you're understanding or not, so that I can clear if you have any doubts. Okay, fine. So far what you have discussed? So far I have discussed only the first part. Out of three parts, I have discussed first part. Now I am discussing the second part. The second part. Where is the second part? Second part is located behind the anterior scalene muscle. Where is the second part? It is located behind the anterior scalene muscle. So what is the branch which is given by the second part? That is called as costocervical. Costocervical trunk. Costocervical trunk. Okay. Now coming to the third part, what is the artery that is given by the third part? Where is the third part? Come on. This is the third part. Now third part gives out a branch like this, right? This branch is called as dorsal scapular artery. What is this branch? This is called as dorsal scapular artery. Okay. Third part gives dorsal scapular artery. So we are done with the discussion of the subclavian artery branches, guys. Subclavian artery branches. So overall, just very fastly, I'm going to tell you that we have got three parts, right? The first part is giving out three branches which goes up into the vertebral foramina, vertebral artery, which is going down into the thoracic cavity, internal thoracic artery, and another one which supplies to your cervical and thyroid. This is called as thyrocervical trunk. Thyrocervical trunk. The second part is called costocervical, behind the second part, right? Behind the anterior scalene. Third part gives out one artery that is called dorsal scapular artery. Right. So far, are you clear with this, guys? Are you clear with this? Before I go and teach you a clinical point, are you clear with all of this? Next, I'm teaching you the brachial plexus, but before that, I'm going to teach you one very clinical point, important clinical point. Are you clear with what I've taught now? Ayman Kazi, yes. Yeah, everyone, Sannyasi Pandit, have you understood the concepts? I hope he's out of the chat. Right. So now look here, guys. Another important thing. Another important thing here is that another you are back, right? Thank you. I thought you vanished. Another important thing here is that, guys, let us go back to the same picture. I'm not drawing it again and again. Let us go back to this picture itself, right? So this picture. Now, what is this picture is the sense? Look here. What I will be doing is I will just cut down this part and take this part with me. Okay. Thank you so much, Sannyasi. Copy, and I'm pasting it here, guys. Right. Look here now. What is the important thing? What is the important thing? What is the important thing is that basically I told you in the starting that subclavian artery gives the first artery which I told you in the subclavian artery was vertebral artery, isn't it? So there is an artery. See, this was your subclavian artery on the right side. Okay. Now there is an artery that is going up like this. I told you vertebral artery, right? So this vertebral artery goes up like this. So this is subclavian. This is subclavian. The vertebral artery is going up like this and joining together to form a single artery. Okay. So subclavian artery from the right side, it gives out this artery called as vertebral artery. Vertebral artery. Even from the left side also, I get an artery like this all the way going up. This is called vertebral artery on the left side. Now both these vertebral arteries, they join together like this and form a single artery. And this single artery is called as basilar artery. Why are you teaching us neuroanatomy now? I'm not teaching you neuroanatomy. What I am teaching you right now is that there is a condition, guys. All of you remember, there is a condition. What will happen is that there might be stenosis of your subclavian artery. There will be stenosis, constriction of your subclavian artery, or there might be some clot, pathological clot, a thrombus within your subclavian artery. So when there is a clot within your subclavian artery, now look here very carefully. The blood is pumped out of the heart. The blood enters into your left subclavian. The blood is entering up into the right subclavian, but can the blood pass further down here and supply your right side of the arm? No, it won't supply, right? So right side of the arm is not having proper blood supply. So in that case, what is going to happen is that, look here very carefully. The blood from the left subclavian artery will go like this. It will enter into the vertebral artery, and within the vertebral artery, the blood goes up. The blood goes up like this, right? And it enters into the basilar artery. Now, if this part is not getting enough amount of blood, there is no blood going there, do you think the pressure there will be high or low? Obviously, the pressure will be low. So when the pressure is low in the right subclavian artery, as a rule of thumb, fluids move from high pressure to low pressure. So right now, where is high pressure? The high pressure is on the left side. But on the right side, because of no blood supply, there is no high pressure. So what will happen is that whatever blood which has entered into the basilar artery, it will come back. It will come back into the right vertebral artery. Look here, from there it is going to come back and finally it will bypass like this and enter into the right subclavian artery. So it means, let us say brain has to receive 100% of the blood. Out of 100% of the blood, let us say 20% of the blood is brought back into the right subclavian artery. It means from the left side, the blood is getting stealed, right? The right part of the subclavian artery is stealing the blood from the left side. So this syndrome is called as subclavian steal syndrome. What is this syndrome called? Subclavian steal syndrome. Subclavian steal syndrome, which happens when there is left subclavian artery stenosis. Very, 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 very high yield. Very, very high yield, guys. Very, very high yield. Very, very high yield. Right. So, did you all understand this subclavian steal syndrome? Right. So, having discussed the subclavian steal syndrome, now let us enter into the main topic, that is your brachial plexus. Very good, guys. Excellent. Excellent. Now, look here very carefully. Look here very carefully. What is brachial plexus, guys? What is brachial plexus, first of all? What is that? Yeah, we know the topic is important. But what is brachial plexus, first of all? Brachial plexus is a plexus in the brachium, right? Yes, this is an answer. The brachial plexus is a plexus in the brachium. But how is that plexus formed? Everyone, whenever they'll put a heading of brachial plexus, directly they'll tell posterior cord, lateral cord, medial cord, there are roots, trunks, nerves, divisions and all. Okay, fine. But what is brachial plexus? How it is formed basically? Look here very carefully. Bunch of nerves. Yes, bunch of nerves is called plexus. I agree. Let us say this is your spinal cord. Okay. All of you know that here we have got a bunch of nerves like this in the dorsal root ganglion. All these are called as sensory nerves, right? So if I divide the spinal cord like this is sensory, this is motor. So all these nerves, they enter into the dorsal root. All these nerves, they enter into the dorsal root. These are your what nerves? These are your sensory nerves. Now from here, lots and lots of motor nerves, they go like this. Green color are your motor nerves, the red color are your sensory nerves. So where are they exactly mixing? Where are they exactly mixing is that, look here very carefully. All these are your sensory nerves like this. Okay. All these are your sensory nerves. All these are your motor nerves. Now all the sensory as well as motor nerves, they join together and they enter into a specific canal called as spinal canal. Spinal canal, right? So this part which I've drawn here, this is called as spinal nerve. Spinal nerve. That is the reason why they tell you dorsal side is purely sensory, ventral side is purely motor, but spinal nerve is a mixed nerve. Why? Because it has got a cleft of sensory fibers as well as the motor fibers. So now what will happen is that some sensory fibers, they go up like this. Some sensory fibers, they go down like this. In the same way, some motor fibers, they go up like this. Some motor fibers, they go down like this. Okay. Whatever fibers which are going up, they are going up, they go backside like this. Whatever fibers which are coming like this, they come frontward like this. Okay. They are going onto the back. This is called as posterior rami. Posterior rami. Okay. The posterior rami, they go back. The anterior rami, they come front. Okay. This is called anterior rami. So what is the definition of brachial plexus? Brachial plexus is nothing but it is a tuft of both sensory as well as the motor nerves which are coming from the anterior rami of spinal cord. Anterior rami on the right, anterior rami on the left, they join together to form a plexus that is called brachial plexus. Okay. And this plexus is formed in the hand, in the arm region here. So you call it as brachial plexus. So right? So you understood it, right? Clear. Now brachial plexus, what is the root value? The complete root value is, look here very carefully, C5, C6, C7, C8 as well as T1. So C5 till T1 forms your brachial plexus. So what are these? Everywhere I've been teaching you, these are called as roots. I asked you roots of every nerve, right? So these are called as the roots, C5 till T1. Now from the C5 till T1, branches come like this. Branches are coming out like this, right? What are these branches? See, these are exactly these branches. This is the branch which is coming out like this. Okay, so these are called as the roots which are coming from the ventral rami. Now the roots of C5 and C6, they join together like this. The roots of C8 and T1 also join together like this. Then why did you leave C7? I don't like C7, so that is the reason why I left C7 alone like this. Here, so what are these called? These are called as roots. Now after the roots, what are these called? These are called as the trunks. These are called as the trunks. So important thing to remember is that each trunk will further divide into two branches. This is called as posterior division. This is called as anterior division. Again, okay, let me put up with another color. This is called as anterior division. Again, we have got a posterior division. We have got an anterior division. Again, we have got a posterior division. We have got an anterior division. So what are these? Anterior divisions. And what are these black color waves? These are called as posterior divisions. What are these? These are called as posterior divisions. What am I trying to show you here? What am I trying to show you here is that all the posterior divisions of all these roots, they join together to form, you know, three nerves are joining together. It means the nerve must be so thick. It form a thick nerve. You don't call it as nerve now because it is very thick. So you call it as cord. Okay. What is this cord? All the posteriors join together to form posterior cord. All the posteriors join together to form posterior cord. Same way, both these anteriors, they join together to form not anterior cord, but it is lateral cord. You know, life is not always easy, so it is called lateral cord. And finally, the last one is called as medial cord. Medial cord. I'm sorry, Ayman, if I am wrong with the spelling. Right, so these are the cords. What are these? These are the cords. So I think in this way, if you approach, instead of looking at a picture as a whole, in this way, if you approach, it will be very easy, guys. So you can very easily divide now. These are trunks into divisions. These are called as divisions, and these are called as cords. Very, very, very easy. Okay. Now pay attention to whatever I'm telling you. Pay attention to whatever I'm telling you. Look here very carefully. I will write those branches, don't worry. But look here very carefully. I told you C5, C6. Okay. From C5 a root is coming. From C6 a root is coming. Both the roots, they join together to form what? What is this? A trunk. This trunk will again divided into a posterior cord and anterior cord. Sorry, posterior division, anterior division. Right? So what did I tell you? That this is anterior division. This is posterior division. Posterior division. So exactly in this trunk region. So this part is called as a trunk region. Exactly in this trunk region, we have got two nerves, guys. One nerve goes up, one nerve goes down. Okay. So what is that nerve? It is going up. Up in the sense infra or supra. Up in the sense supra. So this is called as suprascapular nerve. Suprascapular nerve. Okay. And what is the lower one? Lower one is called as infra. Not infrascapular. It is called as infra. Infra means below. So if you take a clavicle, if you take a scapula, within a scapula, you have got two sides, the dorsal side, the ventral side. The ventral side is called as, what is that called as, where we have got subclavius muscle, not subclavius. What is that? All of you? Subscapular muscle, right? We have got subscapular muscle. Ayman Kazi, very good. Now to subclavius. Yes, right. So what I'm trying to tell you is that most of the students will confuse this way, that if there is suprascapular, there will be subscapular, but it is not subscapular. Okay, it is not subscapular. It is nerve to subclavius. Nerve to subclavius. So where is your subclavius muscle? This is your clavicle. Beneath my clavicle, there is subclavius muscle. Beneath my clavicle, there is subclavius. So it is located below, infra. So the picture represents also the same thing, isn't it? So this is how you remember, guys. My main intention is of teaching so lengthy is that I want you to remember everything without by hearting. Okay, right. So why did I teach you this? Why did I teach you is that how many nerves in total I have got? How many nerves? I'm counting it. C5 is 1, C6 is 2, suprascapular is 3, now to subclavius is 4, posterior division is 5, anterior division is 6. Totally I have got 6 nerves. So exactly this region here, if I get any kind of damage at this point, all the 6 nerves are joining together at this point. If I get any damage here, this point is called as Erb's point. This is called as Erb's point, and if I get any kind of situation where there is damage there, I will end up having Erb's palsy. Erb's palsy. Other than Klumpke's paralysis, Erb's palsy is very, very important, guys. Very, very, very important. Okay. Erb's palsy. I hope you understood this. Right. Now in the examiner, you know what question they will ask you? What question they will ask you after this? We shall be doing the MCQ. You know what question they will ask you? They will ask you is that, look here everyone, all of you. This is the Erb's point, right? Anything anterior to Erb's point, that will undergo paralysis. Because if Erb's point is cut down like this, anything which is anterior will undergo paralysis. But anything which is posterior is not disturbed. It is not disturbed. Look here, all of you look here. This was your Erb's point, right? This was your Erb's point. This was your Erb's point. Anything back of the Erb's point is not disturbed. What I'm trying to tell you is that you have got a nerve. What is that nerve? Anyone? From C5, from C6, from C7, all the way, you get a nerve like this. From C5, C6, C7, you get a nerve, and this nerve is called as long thoracic nerve. Long thoracic nerve. So long thoracic nerve is not at all disturbed. So the question which they ask you is, in Erb's palsy, which nerve is spared? Which nerve is spared? Which nerve is spared in Erb's palsy, guys? Yes, the nerve which is spared in Erb's palsy is your long thoracic nerve. This is a very, very important MCQ. Very, 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 very important MCQ. Yes, very good. Ayman Kazi is telling nerve to serratus anterior. Perfect. Nerve to serratus anterior is your long thoracic nerve. I have already told you that if long thoracic nerve is paralyzed, then patient will have what kind of deformity, guys? Anyone? Yes. Excellent, Ayman. Excellent. Sannyasi Pandit, perfect. Winging of scapula. Tooth ko habila, winging of scapula. Excellent. 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 Very good. Now, karma gaming, polystip hand deformity. I will tell you what is that. I will tell you what is that. So now we have discussed one few important questions. Now look here, another important thing. What are the branches of posterior cord? What are the branches of lateral cord? And what are the branches of medial cord? Very, 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 very easy. Okay. So first of all, let us discuss like this. What are the branches of lateral cord? What are the branches of medial cord? Umid, perfect Umid. It is winging of scapula. What are the branches of posterior cord? Okay. Now, how do I remember? How do I remember? Yes, Dr. Benedict. How do I remember lateral cord? How do I remember lateral cord? It is LML. How do I remember medial cord? Remember it as M for you. M, medial cord is for you. M for you. How do I remember posterior cord? Remember it by mnemonic ulnar. Remember it by mnemonic ulnar. Now let us name the branches. What does L stand for? L stands for lateral pectoral nerve. Lateral pectoral nerve. And what does M stand for? M stands for musculocutaneous nerve. Musculocutaneous nerve. Okay. And what does again L stands for? L stands for lateral root of median nerve. Lateral root of median nerve. Okay. Now coming to the M part. What does this M stands for? When I tell lateral pectoral nerve, here the M means medial pectoral nerve. Medial pectoral nerve. And there are three more M's. What are these three more M's? One is medial nerve of your arm. Medial nerve of your arm. Medial nerve of your forearm. Medial nerve of your forearm. Three M's are finished. What is the last M? Look here. If there is lateral root of median nerve, there will be medial root of median nerve, right? There will also be median root of median nerve, right? There will also be medial root of median nerve. And obviously, what does U stand for? Lily Kriza is telling me that U stands for ulnar nerve. Yes. So U stands for ulnar nerve. We are done with the medial cord also. Now, when it comes to the posterior cord stands with a mnemonic ulnar. U stands for upper subscapularis. Upper subscapularis. When I tell upper subscapularis, there should be lower subscapularis. So L stands for lower subscapularis. And what does N stand for? N stand for nerve to latissimus dorsi. Latissimus dorsi. Okay. And finally, you have got A and R. R stands for radial nerve, you know. A stands for axillary nerve. Axillary nerve and finally radial nerve. Are these branches anything difficult, guys? Are these branches anything difficult for you? Yes. I'm waiting for your answers. You need to be fast. Vinith, Macharla, yes, nope. Right. So look here now. If you revise it, it would be easy, guys. If you revise it, it would be very easy for you to understand. Nothing to worry about that. Now, what are the questions which they can ask you? The first question, yes, Sanyasi, it carries sensation. I will tell you that in a minute. The first question which they ask you here is, they won't ask you definition. What they will ask you is, what is Erb's point? Second question is, how many nerves are included in Erb's point? Third question is, which nerve is paired in Erb's point? Right? Erb's palsy, that is long thoracic nerve. Fourth question is, you know that what are the branches of lateral cord, medial cord and posterior cord. The fifth and the very important question is, in case of C5, C6 injury, what nerves are damaged? What nerves are damaged? Now, if you look at the picture, you will understand. If you don't look at the picture, you need to mug it up. Look here. All of you look. C5, C6. What are located for C5, C6? Just follow the arrows like this. Follow the arrows. So C5, C6, the posterior part, the anterior part like this, right? So obviously, as I'm following the arrow, posterior cord is damaged. I know that. Posterior cord is damaged. I know that. And as I'm following this arrow on the anterior side, the arrow comes down like this. It means the lateral cord also, right? Lateral cord also. But is the medial cord disturbed? No, because medial cord is not in that much connection with the remaining two cords. So mostly which two cords are disturbed is the posterior cord and lateral cord. Now you might ask a question, sir, are all the nerves disturbed? Not all the nerves. What are the nerves are? Nerves of posterior cord, nerves of lateral cord. What nerves are disturbed? Look here. Musculocutaneous nerve will be disturbed. And from the posterior cord, axillary and radial nerve will be disturbed. Okay. So this way you need to look at. Musculocutaneous nerve. Next we have got radial nerve. Next we have got what? Axillary nerve. Axillary nerve. Okay. No, Vinith Macharla, long thoracic nerve is not affected. That's what I told you. Long thoracic nerve branches are these green color branches which you can see here, right? These branches are present before the injury. See, this is injury. Before the injury, these branches are there, so it won't be disturbed. But if these branches are present after the injury, then they will be disturbed. Okay. Now look here. Mainly these three branches are disturbed. Obviously, why not others also will be disturbed, but mainly the damage will be to these three branches. Right? Physically, when you look the patient on examination, you can find the deformities of these three branches only. Okay. Now you tell me here, important thing. What is the important thing? In case of Erb's palsy, what are the features which I'll find? Look here. Look at me now. Look at me. What are the features which I'll find? Axillary nerve is damaged. If axillary nerve is damaged, my deltoid muscle is not getting any supply. If my deltoid muscle is not getting any supply, I think I have told you here itself. I think I have told you this itself. Deltoid muscle is not getting any supply. So when deltoid is not getting any supply, will my arm move laterally like this? Will there be abduction? No. My arm will stick to the body. This is called adduction. Second important thing, teres minor. What is the function of teres minor, guys? Teres minor is responsible for the lateral rotation. For example, if this is my arm, I am laterally rotating my arm. For lateral rotation of my arm, teres minor is important. If teres minor is paralyzed, then what will happen? There will be medial rotation. So far, what are two things you have seen? One is adduction to the body. Next, your arm has been rotated medially. Okay, adduction and medial rotation of your arm. Clear so far? Musculocutaneous nerve is also damaged. Musculocutaneous nerve is responsible for flexion. So patient can't flex like this, isn't it? So patient hand will be straight in this way. Now look here, this type of deformity where my hand is adhered completely to my body, rotated medially like this, right? Rotated medially in this way, this is called as police tip deformity. You know, policemen, they take a tip in this way, right? The police people, I'm talking about the corrupt police people. The corrupt police people, what they do is that they put their hand back like this and take the tip from the person. So this is the reason why it is called as police tip deformity. right? So in Erb's palsy, there will be adduction, Ayman Kazi, you're right. Adduction, okay, and medial rotation because lateral rotation is not working. Medial rotation, right? So that is the reason why you call it as polystip deformity. Polystip deformity. Polystip deformity. Now, waiter stip, yes, even waiters also, yes. Kabela is telling it as waiter stip. Thank you, Kabela. It is also called waiter stip because even waiters also take the tip in that way, right? Fine. This is the important thing. Sir, what is Klumpke's paralysis? Klumpke's paralysis is nothing but if there is an injury at C8 and T1, this is called Klumpke's paralysis. C8 and T1 is called Klumpke's paralysis. All of you clear? Yeah? All of you clear? C8 and T1 is Klumpke's paralysis. So, in patient with Klumpke's paralysis, what will you find? What will you find is that, let me prove this thing. Klumpke's is C8T1. So C8T1 is continuing all the way and showing you the medial cord. So let us see what are the branches that are located in the medial cord. The major branches which are located in the medial cord are ulnar nerve and median nerve. Ulnar nerve and median nerve. So that is the reason why yesterday's class I told you, ulnar nerve involvement plus median nerve involvement is called as ulnar claw. It is called as ulnar claw. $69mega.com looks like they found a girl for me. Thank you. I don't need anyone right now. Right. What I just need now is attention from the students. Fine. So from today onwards, whenever you see ulnar nerve palsy, don't put it as ulnar claw. Ulnar claw is involvement of ulnar nerve and median nerve. Are you clear? Are you clear? Before I go for the MCQs, are you clear now? Be fast, guys. Be fast. Right. Excellent, 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 excellent. Very good. Very good. Now look at the question, guys. Look at the question here. Look at the question. After this, Sanyasi Pandit, claw hand, if single answer, then, I mean, usually they don't ask Sanyasi. They'll definitely give you, right? They'll definitely give you both ulnar nerve and median nerve in the option. If it is not given, only ulnar nerve is given, then put it as ulnar nerve only. Okay. So when the correct answer is not given, you should always look for the best answer. No? Right. A 25-year-old obese mother with gestational diabetes gave birth to a 42 weeks gestation. Okay. She gave birth at 42 weeks. The delivery is complicated by difficulty pushing the child's shoulders through the vaginal canal because you have to catch hold of the shoulders and the head and you have to pull it from the birth canal, from the vagina back, right? So in that case, what will happen is that touching the vaginal walls, there can be damage to the clavicle, there can be damage to the brachial plexus over here. The child's birth weight is 4,200 grams. Notable physical examination is found. So how is this? Which nerve is damaged? Here is asking. Dr. Benedict, look here carefully. Which nerve is damaged? First of all, tell me what is this kind of gesture? Yeah. What is this kind of deformity? This obviously very good. Excellent. This is called as polystip, not? This is called as Ayman Khazi. Very good. Cyanide, very good. Polystip deformity, right? Polystip deformity we seen where We see in case of Erb's palsy, right? Erb's palsy is what? C5, C6. C5, C6 are located above or below? C5, C6 are located above in the upper part of the trunk. So now you tell me, will the answer be upper trunk or lower trunk? What will be the answer? Sorry. Tell me the answers fast. Excellent, excellent, excellent. Ayman, Pavan Kumar Reddy, perfect Pavan. Umeed, excellent. Cyanide, excellent. You all guys are really wonderful. Excellent. Upper trunk, perfect, perfect, perfect. Upper trunk. Okay? Right. Now guys, we shall discuss one last topic, and now we shall start discussing the abdomen. That last topic is cubital fossa. Cubital fossa, all of you know how important is that cubital fossa. Now what is that cubital fossa? Is that, see, this is called as cubital fossa. This is called as cubital fossa. Okay. Now in this cubital fossa, what are the important things? First of all, you have to look here whatever I'm teaching, then you can comment it. Okay. Now coming to the cubital fossa, this is your humerus. What is this? Humerus. Okay. Now I told you yesterday, if this is my humerus, right? If this is my humerus, then what is this big chunk of muscle? This big chunk of muscle which is crossing like this from the lateral epicondyle, this big chunk of muscle is called brachioradialis. And I already told you one more muscle yesterday itself. From the medial epicondyle, there is a muscle that is going like this and attaching like a tree, right? This is called as pronator teres. So this muscle is called brachioradialis. This is called pronator teres. So if I tell you that this is lateral epicondyle, this is medial epicondyle, okay, there is a big chunk of excellent, Ayman. There is a big chunk of muscle that is coming like this, okay. This is called as brachioradialis. Brachioradialis, and this muscle which I'm drawing here, this is called as pronator teres muscle. Pronator teres. So here I have got excellent, Vinith. That's what I was about to tell you. Here I have got a triangle. So what Vinith is telling is that we have to take an imaginary line touching from lateral epicondyle to medial epicondyle. It means like this. Okay, an imaginary line. So here I find a triangle. This triangle is called as what? Cubital fossa. This is called cubital fossa. So I'm not writing the borders because by looking at the picture, you know the borders of cubital fossa. What I'm writing is the contents. Contents are remembered by the name R-TAM. What is R-TAM? What is R-TAM consisting of? Look here. Laterally, we have got this blue color nerve that is running. R stands for radial nerve. Radial nerve. Next, in the center we have got a green color line here which I have drawn here. This is called as tendon of biceps muscle. Tendon of biceps. If you want, you can feel it here, right? You can feel the tendon of biceps muscle. You can feel the tendon of biceps muscle. After that, I have got an artery. I told you already that we have got brachial artery that is coming down here. Brachial artery is dividing into two in the cubital fossa. One goes on the radial side, radial artery. One goes on the ulnar side, ulnar artery. So here I have got an artery like this. I'm drawing it with pink. Brachial artery dividing into two, radial artery, ulnar artery. Right? So this is brachial artery. And what does M stand for? Again, M stands for a new nerve here. M stands for medial nerve. Median nerve. So these are the contents from the lateral side to the medial side. Okay, from lateral to the medial side of the cubital fossa. Okay, from the lateral side to the medial side of the cubital fossa. One very important clinical point. One very important clinical point. Look here. All of you should pay attention now. So this muscle, actually I have drawn pronator teres very simply, but this is how the pronator teres look. Pronator teres looks. What is the medially, completely medially, what do I have? Completely medially, I have got median nerve, right? So this median nerve passes like this. It passes between this pronator teres. You see, it is passing between this pronator teres. So as it is passing between this pronator teres, sometimes there can be compression of pronator teres. When there is compression of pronator teres, medially this median nerve will be there, right? So this median nerve will be compressed. This median nerve compression is called as pronator teres syndrome, right? This median nerve compression is called pronator teres syndrome. What they will ask you is that in pronator teres syndrome, which nerve is compressed? That will be median nerve. Already Pavan Kumar Reddy has answered here. Excellent, Pavan. It is pronator teres syndrome. Okay. So guys, before I start discussing the abdomen, one last question I want to ask you before I give the break is that have you understood all the topics which I have discussed? Right? If there are any minute leftover topics, we shall cover up in one or the other session or whatever it is. But I have covered the major portion related to your upper limb. Did you understood everything? Everything without any doubt? After the break, we shall discuss the abdomen, guys. Okay, guys. So we shall take a break. After the break, we'll take 5 to 6 minutes break, and after that we shall discuss the abdomen part. Okay, we shall start discussing abdomen, and I'm telling you, abdomen is very, 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 very important. Very important. You will right now see how many questions are asked from abdomen. Look here. All these questions are asked from abdomen only. All these are the questions from abdomen. We shall discuss them. Okay. హలో 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 వినబడుతుందా? సునాయి దేరే hello guys, so welcome back. Can you all listen to me? Am I audible? Am I audible? Right, so James, actually we have discussed upper limb yesterday in 2 sessions. So the leftover part I have discussed today, but actually the main topic which we have to discuss today is the abdomen part. Okay, so now we shall start discussing the abdomen. Okay, right. So coming to the abdomen, I'm not going to stretch it, guys. I'm not going to stretch it. I just want to tell you directly. Let us start from the liver part. Okay, so the first thing you have to know here is that, for example, if this is the body, okay, so in here this is the umbilical region. Now your abdomen is divided into some boxes. Let us say your abdomen is divided into some boxes like this. Okay, your abdomen is divided into some boxes. So these boxes are called as, what are these boxes called as? These boxes are called as the Pandora's box. Okay, it is called as Pandora's box. Now you can see here that these are your ribs here. This is on the right side, this is on the left side. So behind the ribs are called as chondria, right? Just below the ribs, you call that area as hypochondria. Below the ribs you call hypochondria. Just below the ribs you have got this organ over here, this organ which is located just below your ribs. This is called as your liver. So from today onwards, uh, if someone asks you where is liver located anatomically, it is located in the right hypochondric region. It is located in the right hypochondric region. You know why it is called as Pandora's box? Pandora in the sense, it is a sense of surprise, right? So patient will be complaining of some or the other abdominal pain. You will be thinking it might be an ulcer or it might be a tumor or whatever it is. But when you start operating it, you will find completely a new thing in the abdomen. There might be an abscess, there might be a perforation. So it is always a new surprise for a surgeon whenever he will cut it down. He will think there might be a tumor, but when he cuts it down and look, along with the tumor, there will also be other pathologies. So every time the abdomen will surprise you while doing surgery. So you call it as a Pandora's box, right? A surprising box. But anyways, they don't ask you this in the exam. Let us start discussing the liver. Liver is located in the right hypochondric region. You know it. Now within the liver, look here, how anatomically I can divide the liver. So this is the liver. Okay, this is another liver. Let us say this is my liver and that is your liver. All of you know that here we have got a vein. What is this vein called? This vein is called as inferior vena cava. Okay, inferior vena cava. Here also I have got a vein that is called inferior vena cava. Now exactly below the inferior vena cava, here I will have a small organ that is protruding outside. This is called as gallbladder. All of you clear? This is called as gallbladder. Now if I draw a line, let us say an imaginary line touching from the inferior vena cava all the way down till the gallbladder, what I have just done, I have just drawn an imaginary line and divided the liver into two lobes. So this is called as the right lobe of the liver and this is called as the left lobe of the liver. Right and left lobe of the liver. Okay. Now This line which I have drawn here, this line is called as Cantler's line. Cantler's line. So in this way, I am dividing the liver surgically into two parts. One is called as the right surgical lobe, another one is called as the left surgical lobe. Okay. But if someone, an anatomist will come and ask me, how are you dividing the liver based upon the anatomy? What is the anatomical division of the liver? Anatomically, how will I divide the liver is that you have got a very long ligament hanging down like this, right? Now this ligament is called as falciform ligament. Falciform ligament. Yes, Bhagyashri. Yesterday is the video of the upper limb. Day before yesterday, I mean the previous lecture also we have discussed upper limb, but don't worry, everything will be recorded. Okay, everything will be recorded. But I want you to stay on the chat because if you get a doubt in this, I'll answer everyone's doubts. Okay, I'll clear everyone's doubts. So anatomically, I am dividing the liver into the right and left lobe. Right lobe, left lobe. Basing what? Falciform ligament. But surgically, if I wanted to divide the liver, I will divide based upon what? Cantler's line. So this is the important point I want to put in your mind. So this is called as surgical division. And this is called as anatomical division. Anatomical division. Surgical division and anatomical division. Now, if someone asks me, sir, I don't have a liver, will you please give me? Yes. Now, how will I give my liver? How will I give my liver is that, which lobe will I give? Which lobe will I give is that the right lobe. The right surgical lobe of the liver always goes to the recipient. Okay, always goes to the recipient. But the left one will always stay with me. I am the donor, right? I will keep the left lobe with me and I will give the right lobe to you. So left stays with the donor. Left stays with the donor. Infinite Sukaumi, everyone can be good at everything, right? So even you can not only be good at anatomy, you can also be good at all other subjects, okay? Right? So this is a new point. This is a new point which you need to know. Okay. Now let us discuss the another important point. Another important point is that I will discuss all the ligaments and all. Okay. I'll discuss all the ligaments and all. Don't worry. But before that, let me discuss this thing. So if this is the liver, very large liver, all of you know that this is my stomach and all. Okay. This is my stomach, duodenum, jejunum, ileum, and all of that, you know that. Now, from the esophagus, from the duodenum, from the jejunum, from the ileum, from all these places, the veins get collected and finally these veins end up into a thick vein. This is called as portal vein. You know it. This is called as portal vein. But what happens with the portal vein? Look here very carefully now. I want all your 100% attention here. This is called as portal vein. Now this portal vein enters inside the cavity of the liver. And this portal vein is divided into two halves. This is called as the right portal vein and the other one is called as the left portal vein. The right portal vein and the left portal vein. Okay. So let me write it down. This is your portal vein. Okay. It divides into right and left portal vein. This is right. This is left portal vein. Another important thing is that I have already discussed that you have something called here as inferior vena cava, right? Just before only I discussed you have inferior vena cava. It means there should be a bunch of veins that should be draining into this inferior vena cava, right? Now, what are these bunch of veins, guys? What are these bunch of veins, guys? That look here. This is called as the right hepatic vein. What is this? This is called as the right hepatic vein. Okay, let me put it here. This is called as a right hepatic vein. Okay. Next important thing. This is called as the middle hepatic vein. Right hepatic vein, middle hepatic vein, and this is called as the left hepatic vein. So, right hepatic vein, middle hepatic vein, left hepatic vein, all these three, they join together and finally all these hepatic veins, they drain into inferior vena cava. inferior vena cava. So this is your right hepatic vein, middle hepatic vein, and the left hepatic vein. Till here, everyone is clear? Very fastly, just tell me yes or no. Very fastly. Yeah, be fast. Okay, fine. I got a green signal now. Fine. Now, because of these portal veins, because of the right and left portal vein, because of the right hepatic vein, middle hepatic vein, and left hepatic vein, I have divided the liver completely into 8 segments. Now, what are these 8 segments? Look here. This is the first segment of the liver. This is the second. This is the second segment of the liver. This is the third. This is the fourth. This is the fifth, sixth, seventh, as well as 8. Okay, I have divided the liver into 8 segments. Because of what? With the help of inferior vena cava and portal vein. This is a question. How do you divide the liver? How do you divide the liver into 8 segments? I have divided the liver into 8 segments based upon 2 things. One is called as a portal vein. Another one is called as a hepatic vein. Hepatic vein. Clear? So this is an MCQ. Very important question. Easy? Yes. Now look here. In the exam, what they'll ask you is that, you told me about right surgical liver, left surgical liver. Can you please tell me, in the right surgical liver, how many segments are you giving me? In the right surgical liver, how many segments are you giving me? I am giving you 5, 6, 7, 8. 5, 6, 7, 8 segments. This one, 5, 6, 7, 8 segments are called as the right surgical lobe. Then, left surgical lobe. Left surgical lobe. So, how many segments are from the left surgical lobe? They are 2, 3, 4. 2, 3, 4 are the segments of left surgical lobe. Then what about 1? 1 is not given to you. You know why? I'll tell you in a minute. 1 is located posteriorly. This is an anterior picture. This is an anterior view. So till here you understood, right? Right. So what I'm trying to tell you is that who is secreting bile, guys? Bile is secreted by the hepatocytes. Let us say there is a hepatocyte here, and the hepatocyte will secrete the bile. Okay. Now the bile that is secreted here, is drained into which part? Is drained into, see, the hepatocytes in the 7th segment will secrete a bile which is drained into the 7th segment. The bile in the 8th segment is drained here in the 8th segment only. Bile in the 6th will be secreted in the 6th. Bile will be in the 5th will be drained into the 5th segment. Clear so far? Yeah. Now you might get a doubt, but sir, bile drains into veins. But you are telling bile is draining into each segment. You are right. Bile will basically drain into the veins. It means, look here, all of you. The 7th segment, whatever bile is released in the 7th segment, that is drained into the right hepatic vein. Whatever bile is secreted in the 6th segment, that is also drained into the right hepatic vein. 8th one is also drained into the right hepatic vein. 5th one is also drained into the right hepatic vein. It is drained into the right hepatic vein. In the same way, the second one, third one, and the fourth one, all these 3 segments, they drain the bile into the left hepatic vein. They drain into the left hepatic vein. Okay, then 5, 6, 7, 8 are draining into right hepatic vein. 2, 3, 4 are draining into left hepatic vein. Then what about the first segment? What about the first segment? I will be telling you in a minute. Okay, keep that point in mind. If I forget to tell you, then remind me. Okay, where the bile is draining into the first segment. That imparts a very important clinical question. Now, I am turning the liver back. When I turn the liver back, this is how the picture looks. Look here, all of you. When I'm turning the liver back, this is how exactly the liver looks. Now, exactly here, now you tell me, this is called as the first segment. Okay. Now, this is called as the second segment. This is called as the third segment, and this is called as the fourth segment. I'm not teaching something new. The same things. See, second and third are located in the end, in the tip of the liver, right? The same thing I have drawn. Second and third are located in the tip. Just nearer to the third, I have got fourth. You see, nearer to the third, I have got fourth. I have just made a replica of this. I have just turned it back. Okay. Now look here. Now, here, there are many important things. What are those important things? All of you should look here. You can see a fissure here. This is called as a fissure. And down also, I can see a fissure. This is also called as a fissure. Now, in this fissure, I have got a very important ligament. You see this yellow color ligament which I am drawing here. This fissure has got some yellow color ligament over here. This ligament is called as ligamentum venosum. It is not yellow actually, but to differentiate the color, I told you. It is called as ligamentum venosum. In the same way, there is a green color ligament here. Between 3 and 4, there is a green color ligament in this fissure. Now, this ligament is called as fissure for ligamentum teres. Everyone is answering excellently. This is called as ligamentum teres. Okay. Now, what is this lobe here where the first segment is located? This lobe over here, can anyone name what is this lobe over here, guys? Anyone? Yes. Can anyone name this lobe? And by the way, don't worry that I have already told you that you have got inferior vena cava here, right? So this is your inferior vena cava. Can anyone name what is this lobe over here? Anyone? Excellent. Excellent, Cyanide. Excellent, Dr. Benedict. Excellent. This lobe is called as caudate lobe. You know what is caudate? Caudate is comma shaped lobe. It is like a comma shaped lobe. That is why it is called as caudate lobe. Now, if someone asks you, right, where is caudate lobe located? Caudate lobe is located on the posterior side. Next important thing is that, all of you look here. I told you that the second segment, third segment, fourth segment, 5, 6, 7, 8, they are draining into right and left hepatic vein. But where is the first segment draining? The first segment, look here very carefully. The first segment directly drains into the inferior vena cava. Directly it is draining into inferior vena cava. Okay, very good, Debi. How are you? It is draining into inferior vena cava. Now, here comes a clinical point. Can anyone tell why did I stress and tell you that the caudate lobe or the first segment drains into inferior vena cava? Can anyone tell the clinical point here? Yes, I'm waiting. Anyone, guys, if you don't know, just tell me You don't know it. Metastasis, Pavan Kumar, yes, he's right. Any more answers? Yeah, come on, guys, come on. Any answers, please? No worries. Right. Sannyasi Pandit, any answer from you? Dr. Benedict. Right. So look here. Why it is so important to know? Why it is so important to know is that, for example, all of you concentrate here. For example, if there is a thrombosis of the hepatic vein here, right hepatic vein, if there is a thrombosis of the middle hepatic vein, or if there is a thrombosis of the left hepatic vein, if there is a thrombosis, can the bile drain there? Yes, it will be drained. Okay, let us say there is a lot of bile which has been drained here in the middle one, in the left one. But whatever bile which has been drained here, can it go further and enter into the inferior vena cava? It cannot enter. So the bile remains there. So when the bile remains there, the patient will have jaundice, right? The bile will be spilled into the blood circulation one or the other time. He will have jaundice. So this condition where there is hepatic vein thrombosis leading to the bile getting accumulated within the liver, not draining into these veins, is called as Budd-Chiari syndrome. And Dr. Benedict, excellent, it is called as Budd-Chiari syndrome. So hepatic vein thrombosis will lead to Budd-Chiari syndrome. Budd-Chiari syndrome. But the examiner will not ask you this question. The examiner will ask you, so all the segments, all the segments like 2, 3, 4, 5, 6, 7, 8, all of them are affected because they were draining into right and left hepatic vein. But the only one segment which is not affected is segment number 1, because segment number 1 directly it enters into inferior vena cava. So that is the reason why segment number 1 is all the time spared. It is healthy. Right, in Budd-Chiari syndrome, segment 1 is never ever involved. In Budd-Chiari syndrome, segment 1 is not disturbed. Is not disturbed. This is an important thing to remember, guys. Important thing. Right, guys? Did you understand? Did everyone understand? Right? Everyone understood this? Right. So look here. This is called caudate lobe. Now someone will ask you, what is this fourth lobe here? The fourth lobe is nothing but called as quadrate lobe. Why? Because it is in the quadrangular shape. Quadrate lobe. So if someone asks you, sir, where is quadrate lobe located anatomically? You should tell that quadrate lobe is sandwiched between, ligamentum teres on one side, and on the other side you have got your gallbladder. This is your gallbladder here. Okay, very good cyanide. You have got gallbladder here, you have got ligamentum teres here. In between both of them, the fourth lobe or the quadrate lobe is sandwiched in between both of them. Okay, this is your answer. So locations are very, very important. Okay, now let us continue, guys. Now let us enter into little more easy things, that if you look at the liver, actually this is how the liver looks. Now what are these two depressions which you have drawn? See, this depression is the place where the gallbladder is located. So this is called as cystic notch. This is called cystic notch because your gallbladder is located here. Then what about this one? This is called as your notch for ligamentum teres. This is the place where the ligamentum teres is located. Ligamentum teres notch. Okay. Second important thing is that if I draw the liver like this with two notches like this, okay, this is the liver. All of you know, very good, Devi. All of you know that we have got a ligament that is coming from above downwards. From above downwards like this. This ligament is called as falciform ligament. Falciform ligament. This ligament is called falciform ligament. And all of you know that every organ in your body is covered by peritoneum. Isn't it? Every organ in your body is covered by two layers of peritoneum. One is called parietal peritoneum. One is called visceral peritoneum. Right? Now, there is a peritoneum that is covering like this. You see, on the liver also, there is a peritoneum that is getting reflected in this way. From both the sides, there is a layer of peritoneum that is getting reflected onto the liver. Now, this peritoneum is coming downwards all the way like this. Look here. This peritoneum is coming downward all the way like this. And what it is doing, guys? What it is doing? This peritoneum is coming down like this. It is coming down, and finally it is making a sheath. Finally, it is making a sheath. Now, all of you concentrate here. We have got a vein during our, during the development of the fetus, we have got a vein called as umbilical vein. This is called as umbilical vein. All of you know. Now, this umbilical vein actually runs into this sheath here. It runs into the sheath and enters into the liver. Umbilical vein usually enters into the liver. But later on, what will happen after the delivery? After the delivery, what will happen is that slowly this umbilical vein undergoes degeneration. Clear? Slowly this umbilical vein undergoes degeneration. But the good part is that some part of the umbilical vein does not undergo degeneration. Rather, this umbilical vein will become too thick. Excellent, Dr. Bendick. This umbilical vein will become too thick, right? Like this. It becomes too thick like this. And this is what is called not venosum. This is called as ligamentum teres. This is what is called as ligamentum teres. Clear, all of you? This is called ligamentum teres. Second important thing is that if someone asks you a question, what is the remnant of umbilical vein? The remnant of umbilical vein is ligamentum teres. Okay. Next important thing is that, as I told you, there is a reflection of this peritoneum. Now, this reflection will go up. See, the reflection is going up. It is going up like this. It goes up all the way. It goes up all the way like this. And finally, it is forming a ligament on the top surface of the liver. On the top of the liver, there is a ligament that is formed here. There is a ligament that is formed on the top surface of the liver. You know what is this ligament called? This ligament is on the top. On the top, what do you keep? You keep a crown. You keep a crown on the top, right? So what this ligament has to be called as? Excellent, Muhammad Bani Kalaf. Excellent. Mutaz Muhammad, very good. This ligament is called as coronary ligament. Coronary ligament. This is called coronary ligament. And you know what will happen? The coronary ligament will go to edges of the liver. It will go to edges of the liver and it will form a triangle here. Coronary ligament on the left side also, it will go to the edge and it will form a triangle. This is called as right triangular ligament, left triangular ligament. What is this called? This is called as right. Excellent, Pavan Kumar. Right triangular ligament. Right triangular ligament. And this is called as left triangular ligament. So guys, within the liver, how many ligaments we have discussed? We have discussed right triangular ligament. We have discussed left triangular ligament. We have discussed ligamentum. venosum, we have discussed ligamentum, teres, we have also discussed falciform ligament, and we have also discussed coronary ligament. Coronary ligament. So these are the ligaments that are located within your liver. So this completes the liver anatomy, guys. And one last important thing you need to know, liver has got two arteries, right hepatic and left hepatic. I will tell you that thing in the next session, right? So this is all which you need to know as far as this session is concerned. And in the next session, continuingly, we shall be discussing many important topics. For example, we shall be discussing the biliary duct, we shall discuss ampulla of Vater, duodenal papilla, everything. We shall discuss the blood supply of your stomach. We shall discuss the clinical points of what will happen when you cut down the stomach. Okay, what arteries are cut down when you are removing the stomach. Okay, and after that we shall be doing a bunch of MCQs. So guys, till here, as this session is concerned, till here, did you all understood all the topics which I have taught you, guys? All the topics whatever I've taught you, did you understood? Yeah, have you understood all the topics which I've taught you? We'll continuing this abdomen part in the next session. Yes, come on, come on, come on, come on, come on. Was this session worthy, guys? I want your feedback, and that's how it helps me to teach more and more with a lot of interest. I'm not deleting, we won't delete it, Medico. We won't delete it. It will be uploaded on the, it will be uploaded soon in YouTube itself. It will be saved automatically. Right, guys. So thank you so much for all your time which you have given me. Yeah. So whatever it is, I want all of you, see, the easy way how you remember all these things is by drawing the pictures. Okay, by looking at a picture. Only when you look at a picture you will understand. Only when you look at a picture you will understand everything, guys. See, if you wanted to save your memory, right, if you wanted to accumulate a lot of things, stored a lot of things in your brain, so the best way to save your memory is looking at a picture and studying. Okay, so only then you'll understand it excellently. And by the way, tomorrow at the same time we have a session on endocrinology, right, endocrine physiology, which is taught by Dr. Sri Teja. So he'll be teaching you endocrine physiology tomorrow. And then the next class will be tomorrow, karma gaming. Yeah, that's what I was telling you. Okay. After that also he will be having the next session on endocrinology itself. So he will update you, but tomorrow at the same time we will have endocrinology session. Okay. Yes, guys, and I want all of you to comment down in the section, not in the live chat, not in the live chat, but within the comment section down. I want you to comment that how is the class. I mean, so far we have discussed a lot of things in the classes, right? And we have discussed the lower limb, we have discussed the micro, we have discussed the upper limb as well. So I want you to comment down and tell me how are these videos? Are they worthful or they easy, right? Are you finding some benefit in them or not? Okay, thank you so much, guys. Goodbye and have a great night.